Hi, I'm Dr. Robert Jean.
And I'm Dr. Darren Hunt. We're members of the University Surgical Associates Hernia Center, and we're here to answer really just the common questions that we get from patients about hernia repairs. I think there's been a lot of attention given to mesh lately and whether or not it's safe to be in the body. And when I talk to patients about mesh, I inform them it is an implant. So you kind of have to think of it like if you had your shoulder replaced or your knee replaced. Those are implants and they can get infected. And that's the thing that we worry about the most. And while that is rare, it can happen. And when those complications happen, they can be serious. So we have to have a good conversation with the patients about whether mesh is necessary and what the pros and cons are. So in general, it's safe, but like any surgical procedure that involves implantation of a device, it can have complications.
This is our standard kind of piece of mesh that is basically made of interwoven layers of suture-like material, and this allows a reaction in the body, and forms a scaffold for that scar tissue to form and help reinforce your hernia repair more so than just typical sutures would do.